Hello, everybody. My name is Oluwashoga, and my partner here in Life and Crime, Genevieve, is here with me. Our venture, MDaas, is providing healthcare for the next billion by building crucial healthcare infrastructure in Africa. So the challenge we're trying to solve is um, is of different. The challenge we're trying to solve is great. If we look at the healthcare system in Africa compared to the population, there's a great inequality there. What we see is that by 2050, Africa will be about 2.5 billion people, but right now our healthcare system is not built for that. We can even barely support the people we have right now. And what we see is that right now there's increased cases of cancer, diabetes, and other non-communicable disease. Um, and by 2050, 46% of deaths will be caused by this. And like Paya said earlier, radiology is a key is key to solving that. So what thing we see is that governments are underinvesting in healthcare across, and we see that hospitals in both private and public centers are under-equipped. 40% of all medical equipment in all facilities are currently out of service. So what does this lead to? It leads to the fact that millions of people can afford and can access care. And when you look a little bit deeper, you realize that the healthcare across Africa is actually concentrated in city centers across the continent. And once you leave the big city centers, the quality of healthcare is actually ridiculously poorer. So how do we try to solve this? When we started, we thought it was just an equipment problem. So we figured out a way to source, refurbish, install, and maintain equipment in these places and provide them with a great biomedical support that goes with it. And one thing we quickly realized was the fact that even though we were really, really successful as an equipment company, we were able to get 70% cost savings to many big hospitals. And so we have a lot of big hospitals in Nigeria as our clients. And we were able to get the equipment at 95% uptimes. One thing we consistently saw was that outside the big city centers, like I said earlier, many hospitals still struggle to acquire our products, even with the 70% cost savings. And also, one thing we observed in many places we looked at was that the operational tools and management expertise to run these health facilities actually don't exist, or they're very poor. So we had to go back to the drawing board and figure out how to actually come up with a solution that can really, really scale across Africa. And that's what we did. So right now, we transitioned from like just an equipment company to an health services company. And what we do right now is we build and operate diagnostic centers in two ways. In one way, we can, in a place of high need and no options, we build a standalone center there. And if we see that there's a credible option there that is just poor, we work with them, supply equipment to them at no cost to them, and share profits from equipment usage over time. Just to run you over one of our centers, I will give it to Genevieve.
Awesome, thank you, Shoga. So unfortunately, we can't bring you all to Nigeria with us, but we're gonna take you on a very quick tour through our flagship diagnostic center, Sunrise Diagnostics, located in Ibadan in Oyo State, Nigeria. So as you walk in the front door here, you'll be greeted by Feyi. She will begin by taking down all of your patient information right here into OleWork, which is our diagnostic center management platform. We are here for an ultrasound today, so she would fill this whole form out and click that. At that point, the doctor gets a notification that you're there, so he already knows that you're in the queue without anyone going to visit him. If he's busy with another patient, you'll head into our waiting room here. But as you can see on that front screen, we are ultrasound number 1, lucky us, so we can go on in. At this point, Dr. Lucas will provide your ultrasound exam. Any images and the radiologist's report associated with this visit will go directly into the OleWork application. We'll take one last stop here in our x-ray room because we love showing this off. And here you can see the radiology images as well, which are also sent directly into the OleWork application. And this is really crucial because it allows us to send those images to off-site radiologists, so we don't have to have an in-house radiologist at every single center. And this allows us to collect a ton of data on all of our clinics. And this is really useful for us, not only to get a better sense of who our patients are, but also to learn how we can serve them better going forward. At this first center, we've already seen 300 patients last month, and we expect that'll increase to a little less than 1,000 every month going forward, so about 10,000 patients seen every single year. And we're also able to follow up with patients after the fact to give them things like appointment reminders and to see how we're doing on our care provision. So what does it take to build one of these centers? We invest about $65,000 upfront. We can break even in about 2 to 3 years. And we get about an 8x return on our investment over the lifetime of that equipment. As I mentioned, we have one center right now, one that's opening up in March, and then looking to build an additional 4 over this next year. And how are we able to do this? We have 2 really key competitive advantages. One is what Shoga mentioned earlier, which is our history as an equipment company. So we're able to source and provide this equipment and build diagnostic centers for 60% less than the competition. And then the second is that OleWork Diagnostic Center Management application, which makes us a lot more efficient and allows us to provide much higher level of care to our patients. And that'll get us from one MDaas to many MDaas. Our initial target market is Nigeria. As Shoga says, Nigeria is a really big place. We all know that. We estimate our target market is about 120 million patients living outside of urban settings that currently need this care, and about a $1.2 billion market today. We have an awesome team in order to make this happen. Shoga and I are half of that team. We have 2 other members. We've all lived and worked on the continent before and have experience in engineering, supply chain, finance, all the good stuff. And so today we're asking you to help us reach our goal of opening our next 5 centers this year. That'll take $525,000, and part of that money will also go to OleWork 2.0, so incorporating all of the lessons we've learned over the first iteration of OleWork, and then also some general operations to keep the lights on. So thank you all so much, and we look forward to speaking with you after as we work to build health infrastructure for the next billion here in Africa. Thank you.